Before beginning, make sure patients haven't smoked or ingested caffeine at least 30 minutes before measurement.
The patient should be seated quietly for at least 5 minutes in a chair. The chair should have a back support, and their feet should be firm on the floor. Their arms should be supported at heart level. A brachial pulse should be found before measurements begin. Cuffs should be appropriate size, encircling at least 80% of upper arm, and aligned with the brachial artery when put on. Make sure cuff is placed on bare skin, so sleeves should be rolled up. Make sure stethoscope earpieces are faced forward toward the front, and diaphragm should be working. Diaphragm should be placed below antecubital space over the brachial artery. You should also make sure that diaphragm is not covered by the cuff. The bowel should also not be covered while holding the diaphragm in place over the brachial artery. Quickly inflate cuff to appropriate 160 to 180 millimeters of mercury. Now slowly release pressure at a rate of 3 to 5 millimeters of mercury per second. Systolic pressure is point where first of 2 or more cortical sounds are heard, and diastolic pressure is the point where fading of last cortical sound is heard. Normative blood pressure values are a systolic blood pressure of less than 120 and diastolic blood pressure of less than 80. Prehypertensive values are a systolic blood pressure of 120 to 139 or diastolic blood pressure of 80 to 89. Stage 1 hypertension is a systolic blood pressure of 140 to 159 or diastolic blood pressure of 90 to 99. Stage 2 hypertension is a systolic blood pressure of over 160 or diastolic blood pressure of over 100. Blood pressure should be measured in both arms during the first examination. The higher blood pressure should be used when there is a consistent interarm difference. Provide to patients verbally and in writing their specific blood pressure values and blood pressure goals.